Okay, so welcome to my talk. My name is Dr. David Duizer. I'm a naturopathic doctor here and the medical director at Finlandia Health Center. Today we're talking about heavy metals and heart disease, and I'm really excited about this topic. My interest in this was generated in my naturopathic education, but my renewed passion has been from Diabetes BC. They're actually doing a trial on heavy metal chelation, and they reached out to all the naturopaths in the area to look to see if we had any patients that might be interested, to look to see if we want to get involved in the study and promote and talk about it. So that's why I'm doing it, in support of Diabetes BC and in support of this great practice. So thank you all for coming and listening to me. This really is part of a larger lecture series that I'm doing on chronic disease. I'm doing two at the current time, one on chronic disease and one on low-carb lifestyle. The meetup group that I have is called Low Carbohydrate Vancouver, and our first meetup is in 2 weeks. So if you want to come back to that, just let Sarah know at the front desk, and we'll be talking about low carbohydrate and disease prevention. So if you're interested in that kind of thing, another lecture series, because I love doing this kind of thing. Now, let's see if my arrows work, and they do. Okay, good. So there's me, a little bit about me. I'm a graduate of the Royal Military College. I did a bachelor's degree in chemistry and psychology, and then went to the Navy as an officer for a couple of years, and then went right to naturopathic medical school. And since finishing naturopathic medical school, I have been here in full-time private chronic disease management practice. My practice is focused on the prevention, management of symptoms of disease, and really trying to get people off of their medications and get back to healing. So we use the naturopathic approach. We try to treat the cause. We suppress symptoms using natural therapies as much as possible, but we have prescription rights that we can use when we need to. That's my whole deal. Here's today's agenda. Talking about the two studies that I'm interested in, but the baseline here is, what are heavy metals? What's our history with them? How do they affect us personally? How do they cause disease? How do we get rid of them? And then a little bit of information about the studies. So this is a really awesome quote from Julius Caesar's engineer, speaking about how they knew that lead pipes were bad all the way back then. So the history of lead is that we started mining it 6500 BC, I believe, a long time ago. We've known it's been bad for us for many years as well, maybe even all the way back to the beginning. So in many writings, it's been documented that many ancient writings have documented that heavy metals are bad for us. So he says water is much more wholesome from earthenware pipes than from lead pipes. Really, really cool old quote. Here's a little bit of history. I'll just focus on lead a little bit because that's really the key part of today's lecture. It was noted by a botanist in 200 BC that it causes colic and paralysis. That's lead specifically. And then a really great quote from a Greek physician: lead makes the mind give way. 1st century AD. We've known for a long time is the point here. In the Middle Ages, heavy metals turned up everywhere. They started using mercury for medicine for certain conditions. Lead was actually added to the wine. They used lead acetate as sweeteners. And then lead became part of pottery, and the wealthy folk were getting toxic from lead because it was leaching from their pottery. As we move into the 1600s, I know I skipped a big gap of time there. There are lots of other key events that happen with heavy metals in those periods of time. In the 1600s, when the mining started to pick up, some regulations came in place because they knew how toxic it was. The rich people were getting sicker than the poor people. They were just exposed more. In the 1970s, the Canadian government established the Canadian Department of Environment, and they started very tightly regulating lead, mercury, and cadmium. We have pretty good regulations now, but we're doing this talk today because people are still being exposed to heavy metals. We see it happening in small towns all over the place where people are still getting exposed. In this city specifically, the city is responsible for the water leading up to your house, but once the water gets to your house, people are still have old pipes that are affecting them. There are things coming from products manufactured in China that are still exposed to lead paint. There are still exposures coming from heavy metals all over the place, whether it be from mercury amalgams, people breaking thermometers. When I do these labs, I often consult with the lab about high mercury levels, and he always loves to tell me, the medical director at the lab always loves to tell me the story of when he was in grade 2, them playing with mercury with their hands in Alberta.
Oh.
And it was just common practice in science class, basically, to use these type of things. So these type of exposures, the key thing about heavy metals is that we store them really, really well. They take the place as cofactors in our body of other minerals, so they make our healthy minerals look low. We're just really good at storing heavy metals. So are we still at risk? Yes, I believe that we are. We do all different types of assessments here, and we have seen alarming levels on all types of assessments, and I'll cover that later. And that can happen for many different reasons, which we'll go through. Here are the heavy metals of concern for me. I'm really concerned with lead, mercury, and cadmium, but other things do come up. We see arsenic from the rice. We see tin and nickel a lot. We see aluminum a lot. We see lots of different heavy metals. They do different things to us. They each have an affinity for a different organ system. Lead specifically, when it comes to lead, we're thinking about how it affects the arteries, because when you make a plaque, so you damage a blood vessel from having maybe too much high blood sugar or having too much cholesterol, the blood vessel gets inflamed, your body starts to lay down calcium, it lays down cholesterol, and it lays down lead. So there have been clinics all over Canada for 30, 40 years where all they do is lead chelation for heart disease reduction. The research is really just coming forward with the extent of benefit you can get from that. With cadmium specifically, we see it from cigarette smoke. It really affects the thyroid negatively. It's so hard on the thyroid. It prevents thyroid conversion, thyroid hormone into the active hormone. It's quite bad for the thyroid. Arsenic, we're thinking about the digestive system. Arsenic, part of the GI tract, causes leaky gut. Mercury, really bad for the nerves. So mercury toxicity, we see things like nerve pain. We see brain fog, which can happen with lead too. But with mercury, we see a lot of shooting pain in the arms and legs. And we see headaches. We see lots of different things. So they're all hard on the kidneys. There's just no way around it. We have to filter them through the kidneys, and therefore they can get there really easily. Got it.
What about pancreas?
The pancreas, I don't know. Well, I don't know much about how heavy metals affect the pancreas specifically. They cause oxidative stress. So when they hit an organ system, your immune system has to reduce the negative effects of that. So first off, you have to have an antioxidant response and then an anti-inflammatory response. So when they get into systems, there can be damage regardless. And as we age, the immune system weakens, and anything can happen. Yeah. Systems affected. These are the two systems I'm mostly focused on in my practice: the nervous system and the cardiovascular system. So when we're doing heavy metal testing and treatment, we're thinking a lot about brain and nerve health. And we're thinking a lot about heart health. That's my role. They all cause fatigue, so fatigue and brain fog. We see a lot of skin rashes, to be honest. Skin rashes often with the tin and nickel, but it can happen with cadmium as well. They're just toxic, and part of that toxicity is that they affect our regular transport of healthy minerals. So we do a hair test here, and the results of the hair test, the lab is owned by Life Labs, by the way. It's called Rocky Mountain Lab. And the way they analyze the hair test is based on Andy Cutler, PhD. His protocol. He's a famous heavy metal scientist, basically. Extremely famous for this work. And he analyzed hair assessments for years and years and years and years, and found out that when the hair deposition is altered, it can be because of extremely high mercury. And so we see that on the heavy metal test, where okay, there's not enough healthy minerals in the hair. Some toxic mineral could be causing that. And that's what Andy Cutler found out. And integrative docs have been using that forever and ever. I can send you all the slides if you'd like copies of this, so you don't have to take notes if you don't want to. But these are the testing methods we use. The conventional, I'm a naturopathic doctor, so I practice primary care in this province. I have prescription rights and lab rights, similar to your family doctors. So we always start with blood levels if we're worried. That's the conventional workup. Are you poisoned? And we've had 3 times in the clinic in my 5 years here where we found some things that were worrisome. We had to call poison control, go through the whole thing. It happens, It's wild. we have seen lead in the blood, and we've seen mercury in the blood. And the recommendation from poison control, if it's not terribly high, so sometimes we've been sent information from other states and provinces about how to quantify toxic exposure in the blood. And basically, if it's not hitting the point where it's causing serious risk, the blood cells, the lifespan of a blood cell is about 100 days. So you try to avoid whatever you're exposed to for 100 days, and it usually comes back down. If it doesn't, then it's more of a concern. So we figure out what you're exposed to, and we avoid it. And that's the safest and easiest way to recover from a heavy metal exposure. And the body should take care of it. The liver, digestive tract, kidneys, they should clear. They should clear. If they don't, it's a problem. Heavy metals are stored really well in the bone, which is why many people come to me. They're worried about heavy metals, and they have begun to experience osteoporosis. So we test heavy metals, it looks high. Okay, it's coming from the bone, seeping into the bloodstream. And the half-life for lead and cadmium, I believe it's both of them, is about 30 years. So it lasts a long time. It lives really well in the bone. And the nephrologists, in my experience, if the levels are not high, they don't want to move it around. The kidney specialists, they don't want to move the heavy metals around too much. So they don't really like chelation unless it's really, really, really important. And I would agree with that. We shouldn't be messing up a situation when someone's feeling healthy. If someone's feeling unwell, then it's important to get them out. And that's my viewpoint. So it's like with mercury. If the mercury stores seem high, we really don't want to dust it up unless there is some nerve pain. There's some neurological symptom profile. So a random urine is kind of like, what were you exposed to in the last 3 to 4 days? That's a first morning urine test. If you're peeing out heavy metals, you were recently exposed, unless you have severe osteoporosis. A hair assessment is about, for every 1 centimeter of hair, it's about 1 month of exposure. So for people who aren't really interested in chelation, they kind of want to just get a baseline of their heavy metal status, they like to do hair tests, and I support that. Most of the toxic ones depose really, really well in the hair, so it's an easy assessment to do. Whereas when you do a urine test, you do a first morning urine, and then you take some provocating agent, and then you collect your urine for 5 hours and see what came back in the vial. That's the detailed assessment. That's the provocation urine. So basically, we see if when you consume a sulfur compound like DMSA, EDTA, or DMPS, what came out in the urine. And then we compare the difference between that first morning urine and what's in the big jug at the end of the day. And often there are different metals in the jug. The supplements or the prescriptions do a really great job at pulling heavy metals out. And the only tricky thing with the provocation test is we don't have reference ranges. All we have is those pre-reference ranges. So we know that there should be really nothing in the urine when you pee first thing in the morning that's toxic. And in the provocation, there's always something. How to quantify that, we have to look back to our elders. We have to look back to what type of treatments have been done by the old school naturopath and medical doctors to help people recover and what kind of success they had. So we all have these kind of set points where, okay, when you do these capsules or this IV, you should not have this much heavy metal in the urine, or this level is okay, and it's kind of normal for your age. And the lab is really great at helping me with that as well. So say, okay, you're 70 years old, you did this chelation, it probably makes sense that there was this much heavy metal that came out. But if it's twice that amount, that's way too much. And it could be associated with symptoms. So it's mostly a case-by-case basis when we're looking at chelation. This becomes important when we talk about the research moving forward. I've experienced with all 3 tests because we do lots of this here. We don't do lots and lots of chelation, but we do lots and lots of testing. And the reason for that is we treat a lot of chronic disease. And the holistic approach to chronic disease is we have to look at diet and stress and sleep and energy and hormones and toxic exposures. So we do phthalate testing, we do pollution testing, we do other plastics, we do all the kind of environmental exposure toxins, and then we do heavy metal toxins, and we look at these levels. And that's why a lot of people like to do the hair test. But often, if cost is prohibitive, because the hair test is $90 and the provocation test is $220, people will go back to their family doctor and say, listen, I think I was exposed, can we get a blood test? And one time it came back positive, and luckily the family doctor agreed to it. They saved some money and they got to do 100 days of avoidance, and then it came down. In that case, it was the overconsumption of fish. So we have some people in the city who eat fish twice a day for 30 years, and then they get a blood test done, and the mercury level is 3 times the upper limit, and they have some fatigue and brain fog and nerve pain. And then this happens often, and then you have to completely avoid fish for 100 days, and the number comes down, and the symptoms resolve. So getting your family doctor involved sometimes is very helpful to get some conventional workups done for free, because a mercury test through the blood we think is like $50. So we, unfortunately, the province makes our patients pay for that. So, some causes. Blood levels. We see mercury exposures from thermometers. We see mercury exposures from fish consumption. We see tin and nickel from old pots and pans. One case of a 50-year-old teapot, and eczema type rashes all over the hands. And we get the heavy metal test done. They have high nickel and tin. Everything else is completely normal. It's like, what is happening? So I didn't know what I was doing. Sorry about that. I didn't know where to look at the time. And after going through my notes and having a call with the lab, we were able to determine that that there was this, and then speaking with the patient, obviously we were able to determine there's this really, really old teapot that was leaching tin and nickel. It happens. And I just had a call with the lab this morning actually about another patient, and they are having real issues with contaminated products from China. So we have a really good health authority here, and they regulate our supplements really well. They often go based on initially what's on the label and if it looks appropriate for our population. And then they do biochem testing, I believe. Some things are getting through the cracks, and they're seeing trace elements. Like, for example, this case was a lithium case. We do healthy metal testing as well. Lithium is a healthy trace element. We had a case where the hair level of lithium was 10 times the upper limit. So that's the first time I've seen that. What do we do with that? They're not in Silicon Valley taking 10 milligrams of lithium every day. They're not a bipolar patient taking 1,000 milligrams of lithium every day. They're just a regular person wanting to get a baseline. So, well, you know what? They're finding some lithium in the multivitamins from China. And if they're using multivitamins from the U.S., some of them purposely have lithium in there because it calms your mood. That's why they take it in Silicon Valley. But in the U.S., you can buy 10 milligrams of lithium over the counter. But anyways, we didn't expect to see it, was my point. And we did. So things come up. And that was a hair test. So the other thing with the blood levels is osteoporosis, which I've mentioned a couple times because I'm very passionate about that. But water levels, you think about Flint, Michigan. Think about some people with old copper pipes. You see copper sometimes. And that's a bit risky. Now we have people in the city buying their water bottles from the yoga centers who promote the copper water bottles, which causes you to have an imbalance in the copper-zinc ratio. So you don't take zinc and copper if you don't need them, because it's very easy to throw off that balance. When we do zinc therapy for immune health and for hormone health, we do it for a few months and then we stop. Now we have people in the city taking copper and maybe getting extra copper from these bottles. We're not sure 100%, but we've had some cases with where copper pipes have been a problem. So I hate to ignore that. And then finally, I should talk about hair levels. So many things deposit really well in the hair. Some things don't. But what's interesting from the hair test is ratios between healthy minerals and toxic minerals. So for example, if we look at things like lead versus calcium, if we look at things like mercury versus zinc, the lab, based on the Andy Cutler protocol, will send us these ratios, and it will say, okay, you know what, this might be taking the place of this, and that's why the immune function is low. That's why the body maybe has thought that we need to react against healthy tissues and get into this autoimmune disease type state, because there's this dramatic imbalance between one toxic mineral and one healthy mineral. And from the hair we can tell those. And it's a snapshot of the last 3 months, which is pretty good because we don't change our lifestyles very often as humans. It's kind of just, we go about what we do and we do it forever. So it's a good snapshot of that. Low total nutrients from the hair. We get all the healthy minerals from all these, from the hair and urine. We do healthy minerals as well. We get to see what's called a left shift. So if you do a test and all of your healthy ones are to the left of normal, then that's low minerals, and that's really easy to pick out. And that causes a whole bunch of different things. It affects all the different systems. stress system, hormone system, the immune system. We need minerals for all these things. They're cofactors in many different biochem reactions. So left shifts are risky as well. So we just do mineral supplementation and things come back up. And it's no problem. Yeah, left shifts are really, really interesting. So we see those in both hair and urine. Then finally, urine levels. I sometimes will just do a pre-test if we think someone's been exposed in the last 3 or 4 days. It's the first morning urine. Often, if we think the exposure was 30, 40 years ago, that's when a provocation test is warranted. Haven't done my wife's yet, but she burst open a mercury thermometer when she was young, and sometimes you just can't stop thinking. But we have some people who have had 8 fillings removed by someone who didn't know what they were doing. You know, so it's like mercury goes from the mouth into the bloodstream really, really quickly. So the dentists in this city are really good at doing it. They have proper technique for suction, but in some communities they don't. And some people are just exposed to these metals in their industrial settings. So we see a lot of people here from industry who are welders or contractors who have day-to-day exposures. Even the film industry has day-to-day exposures as well. From these old buildings they work in the dust particulate matter, there can be heavy metals. It happens a lot. So say you're welding something and there's fragments of metals around. They get into the air and it happens. I live on Broadway, and we have particulate matter on our windowsill in 3 minutes if we leave the window open. It's insane. And it's from brake dust because we're ready to stop light. So these things happen all over the place. Pollution is really bad here. But yeah. Brake dust, yeah. Brake dust. So fragments of heavy metals can get into that. This is sounding awfully gloomy. Holy. I'm sorry, it's not that gloomy. It's not like it was a couple hundred years ago when people were unknowingly exposed, except in cases like Flint, Michigan, for example. The key that we're working with now is that we have a high rate of disease in this country. Cardiovascular disease, cancer, and autoimmune disease are crushing us. We're living a long time, which is really great, but the quality of our last years are suffering. So that's where these things go. So what are the exposures that could be leading to this suffering? That's what we're trying to get away from, and that's what I'm really, really passionate about. Okay, removal methods. So before I get into the removal methods, just give me 2 or 3 minutes, you guys, and we'll start talking about the positive stuff. Removal methods, what do? I already talked about exposure reduction. That's the key. Reducing exposure. So number 1 is removal. Number 2, diet and lifestyle in terms of supporting the detoxification process. We need to be thinking about removing them and thinking about the organs of detox and supporting them. Like the liver needs protein and B vitamins and antioxidants. The kidneys need to be not burdened by these type of things, but they also need fluid. They need water, they need electrolytes. Supplementation, so a lot of people will come in taking supplements for chelation or taking things they know move metals. And sometimes it's not advisable, sometimes it's really, really, really helpful. And then finally, chelation, actually doing the active removal. Chelation, really important in a hospital setting when someone has been exposed and it's an emergency. In the chronic care setting, we try to be safe and reduce the symptoms. So we look at this as a way to treat the cause, but we can track the symptoms as we move forward. And we've had some really great cases of this where we've done chelation with trigeminal neuralgia and we've removed mercury and the symptoms have come down. Severity of pain of the nerve of the face has gone from a 10 down to a 6. We've seen cases of severe brain fog and sleep disorder where we've brought mercury down and things have gone really well. With lead, it's a bit more tricky because lead is part of this slow-growing cardiovascular disease issue. And when you have a slow-growing cardiovascular disease, there's only a few ways to quantify this. Oxidative LDL and inflammation of the vessels. We don't do a lot of these tests because they're also expensive. So with lead, we just know that it's better out than in, and we move forward with that. Okay, stepwise approach. So number 1 is removal. I already talked about the places you get it from. The point here is to get away from those places. So we've had some people had to leave their jobs. We've had some people have to complain to their unions. We've had some people have to do a better job at protecting themselves with proper exposure reduction methods like masks. But some people have to call people in the city who look at pipes in their home We had to do all these things. So water testing at home. And it's proved beneficial. We have, I didn't mention soil, that when we get processed foods from other countries, they might not be managing their soil properly. And that's an interesting one that I recently came across that I haven't been thinking about very much. We're eating a lot of packaged foods now, even when it comes to produce. Our produce is not from here, most of it. And that presents an issue. So, but who's to say that, I was reading one study a couple days ago where it was saying about the farm on the side of the road. And we're talking about my windowsill living on Broadway. Well, what about the farms that are along the highway? What's their particulate matter? And these things are risky. I don't think it's the end of the world, but I think that when disease crops up, we should consider looking at this. It's not, again, this is never my first line way of thinking. When someone comes in, we say lupus. We're not saying on the first visit, like, you need to have a heavy metal test. That's not how we do it here. We do the conventional approach first to make sure that everyone's doing well. And then we look later on. People usually come to me after they've been to all the specialists anyways, but okay, toys from China, I think I mentioned that. Guns, industry. Find and remove, that's the point. Number 2, diet and lifestyle. Okay, so we need to be clearing. Constipation is an issue, heavy metals, as it is with hormones and other things as well. Immune function. We need to have the bowels properly moving. That's why I wrote fiber on here. Cilantro, chlorella, and spirulina, we know those grab mercury really well. They have a decent affinity for other minerals too. So we like those as a supportive approach. Garlic should be on there as well. Garlic, onion, but then cilantro, spirulina, chlorella. These are kind of nice ways to gently move the body. Some of the dosing schedules are a bit weird. Like if we look at chlorella, they come in these little pellets, and you have to take like 30 of them a day. It's wild. I don't know why they just don't make bigger pellets. But anyways, I think they do it because everyone is so different. Everyone is, in terms of sensitivity. When you move metals, you can have negative consequences. So we try not to move them aggressively if we don't have to, which is why I like very simple DMSA protocols. A little sulfur-based capsule that you get that very gently moves metals for a few days, and you take a couple weeks off. That's my favorite protocol. But we do this nutrition stuff as support. Like I said, for the liver, you need antioxidants, protein, and B vitamins. So a lot of people who are doing cleansing aren't thinking about supporting their liver pathways. They're not thinking about glutathione, for example. The production of glutathione is our main antioxidant. Plays a key role in liver detoxification. You need protein to make it, and acetylcysteine or cysteine amino acid. People aren't thinking about that when they just start doing heavy metal cleansing. I'm just going to take tons and tons of chlorella. You'll move them, but you got to clear them. So there's got to be fiber. There's got to be liver support in general.
So you specify cilantro is anti-inflammatory?
Cilantro is anti-mercury.
Mercury. Oh.
Yeah. Yeah, one trial showed that it moved it on its own, but then when you added spirulina with it, it moved it a lot better.
You have to combine.
Yeah.
Oh, okay.
So that's what we do. So we have this heavy metal detoxer, which has some spirulina and milk thistle.
Yeah.
And then we get people to eat cilantro.
Okay. Yeah, I like cilantro anyways.
That's great.
So yeah.
It's great.
Even the salad, yeah.
It's
and
great.
then how about cinnamon?
Cinnamon?
Cinnamon.
I don't know.
Okay.
I don't know.
I know cinnamon is anti-inflammatory, like the same ginger.
Right.
But yeah, I'm thinking.
Yeah, what we're thinking about mostly with these is the sulfur compounds. So for cinnamon, it's ridiculously good at managing your blood sugar. I just did 2 weeks of continuous glucose monitoring, and I've had crazy blood sugar spikes. At times I didn't realize I was having them. When I added cinnamon to those spikes, flatline. Amazing.
You can use the cinnamon as a sugar. You can sweeten everything.
It's pretty good.
Yeah.
It's pretty good. And then sauna. So we try to open the vessels. Sauna, exercise, getting the heat shock proteins up, allowing the vessels to dilate. We got to sweat. When we move these, we try to sweat. Supplementation. I really like milk thistle just as a general support. Milk thistle doesn't detox, but it keeps the liver strong while you move things around. So if we're moving things around, we use things like alpha-lipoic acid, glutathione, or NAC, either one. And we try to keep the liver strong at the same time. So that's kind of what we do at a basic level. We're very cautious about this as everyone's different. We're all different sizes and weights and have different heavy metal burdens. So we take it really easy and slow. A lot of people will take, simply take a combo of alpha lipoic acid and NAC and just take it every day for a while. Some people will do IV glutathiones and then retest after a few months and see where their levels are. Like for example, if we have a blood level and someone has symptoms that fit that picture, and they do some glutathione IVs during that 100 days. If the symptoms come down really quickly, that's a really great sign. So it's an inexpensive way in Canada here to move forward with detoxification quickly. Some people specifically call me to do vitamin C and glutathione at the same time as a gentle way of moving minerals without having to do chelators, without having to do prescription chelation, I should say. And it can be supportive because when you do these type of IVs, you can add minerals and B vitamins, and it's quite effective. With this, not only with this left shift, the left shift is when you have low minerals. Not only with that, but when the heavy metals are high in general, we like to give minerals because of this ratio component. Like we try to think about, let's take up the cells with zinc, let's take up the cells with magnesium, and so we bring up the healthy minerals. Let's take a little water break. Thank you guys. Thanks. Okay, good. Thanks for waiting, everyone. I really appreciate it. Sorry for that interruption. Alpha lipoic acid. Hi. Yeah, alpha lipoic acid, and it comes with a couple different forms. What you'll notice is that the form that's less active, the doses are higher on the bottle. The form that's more active, the doses are lower, so you don't need to take as many. It's really good at moving mercury, and in doing that, some people can feel worse. So when you move around metals, you feel worse for a few days, like many therapies. Like for example, when you treat an injury with, say, acupuncture, people normally feel worse that day. With heavy metals, it's a bit trickier because the symptoms are mostly subjective, like brain fog and low energy and low mood. When you move it around, when people start taking ALA, sometimes they feel worse for a few days. And that's perfectly normal, as long as they're doing it safely. So the path that we take in our clinic is we first start by testing the kidney and liver function, just to make sure it's adequate. Because if the liver enzymes are high, and the liver's not filtering well enough, you cannot do chelation. So fortunately, Life Labs only charges $15 for this. It's an inexpensive test that we do in the clinic. Liver enzymes and kidney function testing to make sure that people can filter properly. And then we give the go-ahead, supplementation. Yeah. So a lot of people have had experiences where they have started chelating on their own without doing these type of testing, and whether it be fatty liver or liver cirrhosis or too much alcohol, for example, they just can't clear well enough and they get worse when they start taking ALA. Yeah. You have to eat well too, so if you're not having bowel movements, it doesn't matter what kind of liver function you have. So those are the kind of things that we've run into here. So supplementation-wise, it's mostly about liver support, mineral support, and then trying to move metals if it's appropriate in that case. Often, we like to just remove and wait, but if it's more complex or chronic, we try to support and clear.
What kind of protein is for liver support? All kinds?
Well, specifically you need the cysteine amino acid at the baseline, so that's N-acetylcysteine. But just having general amino acids, a typical protein is helpful. The thing about meat is it raises mTOR, which is inflammatory, so we don't want to get inflamed while we're chelating. So we want to stick to vegetarian sources if we can, but we really hit the marks with supplementation. So we hit the either N-acetylcysteine or glutathione, and then we make sure that people are getting the appropriate amount of grams per kg of weight. So for example, if you weigh 150, you want to be getting like 40 or 50 grams of protein a day while you do this, just to make sure it's enough. We have some people who eat very, very, very low protein or very, very high protein from meat. And both those situations are hard on this treatment. So it's got to be, we try to stick between 0.8 grams of protein per kg up to 1 gram, unless it's an athlete.
So would it be a supplement form?
No, just food. Yeah, the supplement would be like NAC. And for example, the one I use is called Clear HM by BioClinic. And it has NAC, alpha lipoic acid, milk thistle, vitamin C, magnesium, a little bit of zinc, and a little bit of spirulina. All in one. Yeah. So then there's multiple dosing schedules you can use. Like if you're just doing very simple things like just supportive, you can just take a B vitamin and then take 2 of these.
Mm.
If you're in the middle of chelation, you can take a lot of these. Make sure that it's all being cleared 2-3 times a day, which is what I'll do.
Mm.
So we may try to make it easy. Like, I don't want people taking 20 supplements.
Oh, yeah.
So that's more like a multivitamin.
Yeah. And then magnesium is not any kind of magnesium.
Well, you know, if you take citrate, it's just going to give you diarrhea. So yeah, the types are very important.
Yeah.
And so when it comes to magnesium, if you want it to be absorbed, it's got to be either oxide or bisglycinate. They have different
I
affinities.
think I'm taking this one.
Bisglycinate, yeah.
And it's working well.
It's really well absorbed.
Yeah.
Yeah, it's really well absorbed. That's why we like to use it. Okay, number 4, chelation. So this is a little graph here that shows how well EDTA works for clearing heavy metal. So you have a baseline. This is a urine lead, just one sample of lead. They take a baseline and some placebo measurements, and then look at an EDTA graph, and it's just tons and tons of lead. So it really works for clearing minerals. DMSA works as well. It's broad spectrum, clearing lots of different things. But DMPS is very specific to mercury. Those are the 3 things we use in the clinic here. Sulfur-based compounds, prescriptions that sort of gently remove heavy metals if you do the right dosing. So what I want to talk about today is a couple different trials. One that was done, that's called tact 1. Tact 1 was trying to tell us how much benefit we can expect from chelation. So we have a cardiologist called Dr. Lamas who did not believe in chelation, and he got to a point in his career where he thought there might be benefit from it, was funded to do a trial on it called the Trial Assessing Chelation Therapy. And he's famous for some pacemaker trials, and a very, very interesting guy down in southern U.S. So he did the tact 1 trial, and some very fascinating data came back from that. Basically, what they showed, and I should bring up these graphs for you at the end, what they showed was that EDTA chelation did nothing for the prevention of heart disease and for the all-cause risk of death for the population. So his conclusion from the study was that chelation was not worth it. And the cardiologists were very simply like, yes, that's what we thought, it makes sense. As we evaluate the trial, this is how naturopaths are trained in chelation. We start with tact 1 trial. As we look at the trial, they didn't test heavy metals. They just gave chelation to a bunch of people. And that was a mistake. They couldn't do it because it was too expensive to test the heavy metals for each individual patient. So that was very frustrating. So there's no heavy metal test. They just did EDTA chelation, 3-hour IVs, 40 times for 1,000 patients or 1,500 patients or something. With a lot of people. And it showed that it had, over 5 years, I believe, there's no risk, reduction in risk of death or cardiovascular events. But interestingly, when you look at this trial, if you just take out the diabetics, only the diabetics who have had a heart attack, their risk of another heart attack cut in half. Their risk of death over 5 years cut in half, even without testing the heavy metals. Very, very interesting. So why did this happen? That's the question. So when this information is presented, it's like, oh, that's crazy. That's how did that even work? Diabetics who had cardiovascular disease, their risk was cut in half of more intense cardiovascular disease, and their risk of death significantly reduced. So over the period of time that they studied, I believe it was 5 years, 41% reduction in risk of heart attack, a second one, and 43% reduction in all-cause mortality. So that's a relative risk reduction. So if you have a couple people per 1,000, so let's say it's 2 people of every 100 died at 5 years. Well, now only 1 person is dying. That's a relative risk. So if you look at a large population, if you look at millions of people, that's significant. And we know now a lot of people have diabetes, and a lot of people have had cardiovascular events. But that wasn't even the most interesting thing about the study. The interesting thing was that they didn't test heavy metals, they didn't test inflammation, they didn't test oxidative stress. So the NIH gave them $37 million to do it again. And that's what's going on right now. Why did this work for diabetics? Well, EDTA is a bit of an anti-inflammatory too. It it might have other mechanisms. The interesting thing about this study, their blood sugar was not altered. Their fasting blood sugar stayed the same the whole time, but they had a significant reduction in risk of passing away. Their A1C was not tested, which is the average of blood sugar over 3 months. They didn't test it, so they missed out on that too. I think they're going to make up for that now. But their blood sugar in general, fasting, first thing in the morning, no change. So the probably same amount of stress on the heart as there was before. But for some reason, if you do EDTA all the time, the risk is reduced. So it's probably because it got rid of lead. Lead causes oxidative stress on the vessels. Lead causes increased plaque buildup. Chelation removes lead. So the idea here is that it was the lead that was the problem, and either diabetics are more exposed or more susceptible because their arteries are at risk of damage from blood sugar just being too high. Their organs are at risk from damage, and that might be why the mortality went down a little bit more than just the heart attack risk. So really, really exciting because there's a lot of people have diabetes, I'm sure you know. So that's what happened. No change in blood sugar, but everyone was a bit healthier. It was a hard therapy though. So the cardiologist, I totally empathize with them or sympathize with them. So who's going to sit down for these big long IVs all the time, every week for a year, for 40 weeks, right? It's so much work. Well, if the mechanism is removal of lead, you can take the capsules and it removes lead too. So that's going to be over the next years and years and years. They're going to find out easy ways of doing this. After this next trial, you might find that there are clinics popping up more frequently that only do lead chelation for cardiovascular reduction. Who knows? Because we don't have the data yet. Compared to the standard of care is just avoid the source. Unless it's acute poisoning, then they do chelation in the hospital, and they're very good at that, thank gosh. But standard of care for cardiovascular disease prevention, well, what is it? If you have a cardiovascular event and you have diabetes, what do? Well, they give you diabetes medications, and they give you a blood thinner and a cholesterol pill and a blood pressure pill. And there's a reduction in risk of another event by 20, 25%, maybe even a little bit more. That's significant. Not 43%, not as much as this. This is a bit harder than taking pills. But this is pretty good. So I think it's interesting. I think it's interesting for the conventional side. I'm excited to be a naturopath at this time because we do these therapies anyways based on the mechanism of action. Heavy metals are better out than in. But what's going to go forward? Well, now is tact 2. He got his funding, $37 million, reached out to Diabetes BC to be a testing facility. And what they're doing is they're saying, okay, now let's just take diabetics who had a heart attack and let's just do it on them. But also let's test their lead at the start and at the end, see if it got better. And let's look at oxidative stress and inflammation as we go. So regardless of these people had diabetes or heart attacks or diabetes, we're going to know just the effects directly on these biomarkers that we all test and love from this type of intensive protocol that many people do. Like if you see a naturopath who does chelation, many of them will do 10 to 20 EDTA IVs. It's not a practice that I typically use because I think it's quite difficult for most patients and maybe not warranted in a lot of cases. But I can see it for diabetics who are trying to reduce the risk of another heart attack. Yeah, okay, let's sit down and let's actually do this work because of that first trial. I think the mechanism is mostly the removal of the minerals, and it's probably the same thing with cadmium and the same thing with mercury. So we just get them out. So they're going to test, they're going to treat, and they're going to see how it goes. So if you know anyone who's over 50 who had a heart attack and also has diabetes, they can get paid to go do it and be a part of this amazing research moving forward. They pay $50 a week, and you get to go and sit there and watch a movie and reduce your risk of another cardiovascular event, unless you get the placebo. If it's placebo controlled, half the group will get placebo. So it'll be very, very exciting for us. So I'd like to finish with this. The keys from this talk: cadmium. It's in cigarette smoke. It's in pollution. It affects the thyroid. When people come in with hypothyroidism, we know it's probably not iodine, because everyone in North America has decent iodine levels. It's probably Hashimoto's disease, an autoimmune disease. But what caused the immune system to freak out was a cadmium. So we test cadmium, and it's come up 3 or 4 times. Well, yeah, it's crazy high. It's crazy high, especially in people with kidney disease, because they can't clear it very well. When it comes to arsenic, it's in the rice. It's in a lot of different types of rice, and it affects the GI tract. It affects the digestion. So we say, geez, you know what? I react to rice. It's gonna be a really hard time. Well, if there's a disease process, I like to go down this road. Like say they have Crohn's or colitis or celiac disease. Gosh, maybe there's arsenic too. And it's very simple to figure out. Simple hair test or a urine test, whatever. If it's cardiovascular disease, if there has been a heart attack or a stroke, well, we have to just look back. Has there been lead exposures? Have you had blood levels of lead done? Are you using some type of product or working in an industry where you're exposed to lead? That's really important to me. With cardiovascular risk, naturopaths have access to all the advanced cardiovascular testing in the US. So we do things like oxidized LDL, we do things like antibodies to the arteries in the heart, we do other markers for plaque buildup, we do it all. But when those are completely normal and there's no reason for a cardiovascular event, gosh, it's kind of nice to see this. Mercury, I look at mercury like, you know what, it's really, really bad for the brain. And we see tons and tons. If you've heard of the drug gabapentin, there are thousands and thousands of people in this city who take that drug. Basically, if you have nerve pain, the first line therapy is gabapentin, and if you scale the dose up, the nerve pain comes down. But that's often done without figuring out the source of nerve pain, and figuring out the source, I think, is really the key. We're looking at long-term wellness, because what if the sources could cause some other risk? Like, for example, lead is associated with cancer. Some strong associations with lead and cancer. Mercury causes damage to the nerves, so we have to look out for that.
So if you're exposed like 40 years ago, it's still a risk?
It is. Yeah, it is. And the mercury fillings, they expire after 30 or 40 years too. So we have a lot of people who got mercury fillings in the 70s who still have tons of them. The same ones, they're not replaced. And they start to have nerve type symptoms. So, but we don't like to mess with it if there's no symptoms. But if there are, it's worth checking out.
So if you're exposed to it physically, like when you have,
Yeah.
I remember playing with it at school.
It's absorbed in the tissues really well.
So and then there's mercury in the fish.
There
And
is.
if you use a lot of fish, especially tin fish.
Yeah. So we do the blood test first, and the blood test says the red blood cell level of mercury. So the red blood cells, they live for 100 days, and often if you eat too much, it'll show up there, be above the upper limit.
Would it show in a normal blood test, or is it specific for mercury test?
A specific for mercury.
Oh.
Yeah. Which the family docs can order, and we can order too. I don't know what we charge. It's not that expensive. So it shows up. We have some people who work in dental facilities who have had high blood levels, who do mercury filling removals. And even though they're following all the steps properly, still have high levels. And it's because it gets into the air and it gets in the body. So it happens. So the blood test is a simple way of knowing. And when you do the blood test, then it's really easy to get the conventional side on board, especially if you have some real problems, like something serious where you need some imaging done or something. The blood test, they know about the blood test. With hair and urine, they're a bit more skeptical, which I totally understand and support. It's not an emergency if it's hair and blood, or hair and urine, I mean. But if it's blood, it could be emergency. So it's helpful to know. So what about stress? What about hormones? What about sleep? What about all these things? In order to properly detoxify anything, you have to be clearing, and everything has to be functioning perfectly. So when you're living in a polluted city, when you are exposed to things, a lot of people are experiencing constipation. It makes them sick. It makes estrogen be reabsorbed, which causes high estrogen dominance. Same thing's happening with heavy metals. Same thing's happening with other toxins. When you're really, really stressed, immune function is suppressed. So the immune system starts to get a bit strange, and it can do things that aren't supportive of your overall wellness, your long-term wellness. Sleep is the time when we do most of our detoxification, most of our healing. A lot of people don't sleep well. So as a naturopath, we'd like to double down on all these things and make sure that the system is perfectly working. Any questions?